Choosing a useful app is a challenging task for users due to the vast number of options available. The majority of available mental health apps lack empirical evidence, leaving consumers with access to a plethora of untested apps whose benefits are uncertain and unsupported. One commonly used approach for finding a mental health app is to browse app marketplaces like Google Play or Apple App Store and download the most popular or top-rated app available. However, when it comes to health apps, user ratings do not always indicate the clinical effectiveness or utility of the app. They have only a moderate correlation with objective measures of app quality rating. The people who provide app ratings are often a biased and self-selected group, potentially consisting of those with either an extremely positive or negative experience to share. They may not have engaged with the app for an adequate amount of time or have the necessary expertise to evaluate its effectiveness. Additionally, app developers can manipulate ratings by providing fake reviews, which makes it difficult to distinguish genuine consumer ratings from fake ones. In conclusion, even if user ratings exist, and are often taken into account by users when choosing a mental health app, they do not provide reliable information on app suitability. Apps can also be chosen based on other people's recommendations, lists of best mental health apps, or advertisements. None of these guarantee the suitability of certain mental health app for a given case or patient. Patients are more inclined to download and use a certain app if it is recommended by their healthcare provider. Consequently, increasing healthcare providers' familiarity with mental health apps may be an important way to help patients find the appropriate app for them. However, the suitability of a given app may depend on many factors outside the expertise area of a healthcare provider, for example, privacy, use of data, technical parameters, user experience, etc. Another way to find the right mental health app could be the app rating guidelines. These typically specify the characteristics that should be taken into account when evaluating a mental health app, often along with explicit criteria that define what qualifies as a high-quality app in relation to those characteristics. There are various such guidelines available. One example is the EACEA App Advisor developed by the American Psychiatric Association, APA, to enable mental health professionals to make their own educated decision about particular apps and their suitability for their practice. The app evaluation model takes into consideration the following aspects: access and background, privacy and safety, clinical foundation, usability, therapeutic goal. However, the app rating guidelines don't necessarily simplify the process of finding an appropriate mental health app and still demands a considerable amount of effort from the user, who must then evaluate the chosen app. Finally, some very helpful tools could be the app rating platforms which identify, rate, and provide clear information regarding the mental health apps. Some examples of such platforms are the following: Organization for the Review of Care and Health Applications, EACEA. EACEA is a platform that rates and reviews health apps, including mental health apps. They provide a comprehensive evaluation, assessing an app against 350+ objective measures and covering the fundamental areas of quality, data and privacy, security, accessibility, and professional assurance. OneMind Cyber Guide. Cyber Guide provides unbiased, scientific reviews and ratings of mental health apps based on apps' credibility, user experience, and transparency of privacy practices. Mind Tools. Mind Tools provides in-depth app reviews using in-light rating scales that covers usability, visual design, user engagement, content, therapeutic persuasiveness, and therapeutic alliance. Mobile Health App Database, MHAD. MHAD provides information and reviews of mobile health apps available in Germany. They provide apps quality assessment based on Mobile Application Rating Scale, MARS, a scientifically validated tool which covers the areas of user involvement, functionality, aesthetics and information quality.